Morning, Miss Julie. I'm Dr. Mani. I'm one of the hospitalists here, and you've been admitted to my team. And this is we do a multidisciplinary round-in. I've brought in the whole team who've been taking care of you and will continue to be taking care of you from now. And we're going to introduce each other. I'm Dr. Mani, as I said, and this is going to be Aisha, your nurse.
So I'm Kelly. I'm representing your therapy team.
I'm Stephanie. I'm your clinical pharmacist.
And I'm Lisa, your case manager.
Woo,
All right.
it's a lot of people.
Yep. Yes, Miss Julie. So, how do you feel since you come in?
Well, my left side's still not working very well.
Okay.
Yeah. And then I've been having a headache and I've been going to the bathroom a lot before I came.
Okay.
Yeah.
Do you feel any improvement in your strength?
It's gotten a little bit better, but it's still not very good. I mean, she could hardly stand me up.
Okay. Any fever chills with this last night?
Yeah, I was all sweaty last night. They had to come give me a bath.
Okay. All right. Any blurry vision or headaches today?
No,
Any
no,
chest pain?
no, sir.
Shortness of breath?
Mm-mm.
Okay. Any other symptoms that you're worried about?
No,
Okay.
that's it.
All right.
Just me
Well, I
going to
looked
work.
at I looked at your labs and I see that you do have a urinary tract infection. So we are treating you with IV antibiotics. Okay, we're going to continue some fluids for you for today. Clinically, your initial CT was normal, but clinically you look like you have a stroke. Okay, you do have risk factors for a stroke. Okay, I see that you're a smoker and also you have high blood pressure. On presentation, when you came in, your blood pressure was high, and we also suspect that your cholesterol also should be high. Okay, so right now we're treating you as a stroke patient. We're doing a stroke protocol, so you'll be getting some more testing done to confirm the stroke, which is going to be an MRI, an echocardiogram of your heart, and a scan of your carotids. All right, and I'm going to go over to your nurse to see the events that happened from last night to this morning.
Overnight, she did have a low-grade fever. It came down with Tylenol. Her vitals have been running in the 160s over 90s, but she's in parameters. Had a little bump in her white count at 14. Her LDL is 120, and she's not currently on a statin. Urine culture is still pending in the lab, and she does have a Foley, so if we can get that removed, maybe. And then she was requesting a nicotine patch overnight.
Wonderful. So let's give her the nicotine patch. You're right about the Foley. We put it initially in the ER because you were very weak, but I think now we'll start bladder training you, and then within 24 hours we'll get the Foley out.
Okay.
Okay? That's going to be the plan. And any other concerns that you want me to take care of?
No, sir.
Okay.
Not any that I can think of.
Okay.
She
All
does
right.
have telemetry, but
Yes, we'll continue tele for another 24 hours, and then that is to monitor your heart. And if your heart rate seems stable for the next 24 hours, it'll be safe to take that out. Okay. Next is your physical therapist.
So physical and occupational therapy came by and worked with you this morning. You do still have the weakness in your left arm and left leg, but we were able to stand her up. You tolerated therapy very well, but I definitely think you need more. And then speech therapy will be by to see you at some point this morning as well.
Excellent. And our pharmacist is going to go over the medications with you.
Okay, I'm going over your medication record, and you're on all the correct medications that you need to be on for a possible stroke. You're also on IV antibiotics for possible UTI. We're waiting on the urine cultures to come back. As soon as they come back, we'll verify that you are on the correct IV medication, and we can also switch it over to by mouth medication once you pass the speech eval. You were on some blood pressure medications at home and something for your cholesterol. We will be able to reinitiate some of those medications as soon as you're evaluated by speech and ready to go with that. So we will reinitiate some of those. And also, if you are started on any new medications, I'll be able to address those with you before you leave the hospital.
And Stephanie, what about the IV antibiotics? We'll switch it later once the culture comes. Okay.
Right, once the culture comes back, we
Okay.
will verify that it is the correct antibiotic, and if she's available to take PO meds, we will switch her over to
Okay.
by mouth medication.
Excellent, excellent. Okay. And that's going to be a case manager who's going to be looking at the disposition part. When you get discharged, what is going to be good for you?
okay. So we'll look at what is recommended, either maybe home health or inpatient rehab.
It all depends on how you're doing with physical therapy.
Yeah, my son had some questions about
Sure, go ahead, sir.
So, when can she eat? It's been like a day and a half. She's getting really hangry.
I totally understand. I mean, patients with stroke, this is why we keep you NPO, because there is a high risk of aspiration. That means when you get stroked out, your throat muscle cells also can get weak and paralyzed. So when we put food in your mouth and you swallow, there's a chance it can go into your lung, and that can cause severe, airway compromise. So that's why we have a speech therapist to come and evaluate you. Clinically, just looking at you and with my physical examination, I think you should be cleared by speech therapy very soon, but I'm going to ask Aja, your nurse, to start calling the speech therapist and see if they can do something early.
Absolutely.
So they're going to be making rounds early, and the minute they clear her, how about putting her on a cardiac diet?
Sounds good.
Okay.
What medication changes can we expect? I keep a list of all her medications. I do her pill box every week. I want to keep it all straight so when we go home, there's no bumps in the road that put us back here. What can I expect to happen?
Sure, there is going to be some changes. She will be on a blood pressure med, she'll be on a cholesterol med, she will be on aspirin and possibly even Plavix,
Okay.
depending on what the neurology team, who's going to be coming in later today, they will be making recommendations, and we will look at that, and then Stephanie will go over all the medications with you before you leave. So that, and they will also set up a pill box for you when you're leaving.
Okay. And like Kelly had said, Mom was really weak when they tried to get her up earlier, and I'm really thinking she's probably going to go rehab. I'd like her to go to Lafayette Ortho Rehab. Do I need to go ahead and try and get a bed with her for it and just send paperwork? What do I need to do to get her approved there rather than somewhere else where I don't
Absolutely,
want her going?
absolutely. I mean, that's a very legit question. Just by looking at your mom and her deficits, I think she will qualify for rehab.
Okay.
We'll see how she does for the next 24, 48 hours. If she does not make any good improvement, Lisa will automatically start, or your case manager will start talking to your insurance and also to our rehab. And yes, we will get you the rehab of your choice.
Okay.
At least we'll attempt and try. Okay? And once that is set up, and we will let you know, and once the bed is ready, we will transition you there. And meanwhile, we'll be doing the acute care in-house over here. And if you have any questions anytime, you know our names, you can call any one of us, and we'll be more than happy to help you.
Alright, thanks,
All right.
Doc.
Just to recap, we're gonna address the culture and change the antibiotics. As soon as speech clears, we're gonna start diet, aspirin, and the statin. And physical therapy is gonna continue, and occupational therapy is gonna continue. And Lisa, you're gonna coordinate the discharge plan. Any other questions you have for us, ma'am?
No,
All right, then thank you then. See you later.
Bye.
Thank